All right. Welcome to another episode of Dentalflix Uncut. I'm here with Dr. Katie McCanley. Welcome to the show. It's so good to have you here.
Thanks for having me. I'm really excited to chat with you today.
Me too. I've had the pleasure of hearing your story, learning about your journey. This is not the first time I've interviewed you on a podcast, and you are such a maven in our industry and just a leader. And I would love for you to share who you are and how you help our industry currently.
Yeah, Maven. I love that word actually. I'm Katie Lee, formerly Katie McCanley, but either one works. So I'm a general dentist based out of Aurora, Colorado. I previously was with a large DSO and then I exited that in the end of 2022. And I decided to put my focus more on oral systemic health and the mouth body connection. And so I wrote a book called Saved by the Mouth that came out a year ago. I can't believe it's been a year. It feels like it was a lifetime ago. But someone just reminded me that it was last year. So it's been the year anniversary of my book, Saved by the Mouth, which is all about oral systemic health. It's written for the patient just to kind of bring them up to speed on how the mouth affects the whole body. But it's heavily researched. So it's great for clinicians too, as an introduction. And then currently, I am building an oral systemic health clinic here it's going to be in Centennial, Colorado. Really excited about that. It's going to be all things oral systemic health. So think dentistry, think functional medicine, chiropractics, acupuncture, women's health, sleep apnea, aligners. You name it, we're going to have it in there. And what I'm really excited most for is the training and education center that we're building. So we're going to be able to educate patients, but then also train clinicians from around the world on the practices of all things mouth body connection. So really
Oh
excited
my
for that.
gosh. The reason why I think this is so smart is I've seen such a huge shift and like being on Align Technologies faculty and being kind of in some of the data of our consumers, it's you're taking the approach of educating not just the clinicians, but also the patients who right now have changed so much. Like the
Mm-hmm.
demographic of our modern patient is so different than it was 10, 20 years ago. And I think with technology, AI, like everything that's happening in the world right now, our patient is more educated and cares more about what's going on and they're looking for answers. So I think one of the most effective ways that we can get this information out there is not just through our clinicians, which is so important, but also with the patient education and their desire for this knowledge. So I love that. What made you feel that was so important?
You're so right in what you just said. And a lot of kind of my approach came out of just pure frustration.
Yeah.
I owned several offices. I owned over 80 practices prior and served as clinical director over a lot of different states. And I cannot tell you, Allison, how frustrating it was every day for me to go and try and talk to and train and educate clinicians on oral systemic health. And it's like they just were very slow to come to the table and realizing that it was something that actually we needed to be paying attention to. And I think it's because, we were in COVID, right? So we were trying to
Mm,
just survive, our businesses to survive. And then there was a staffing crisis and, we had patients knocking down our door. So I get that it's really hard to kind of add to your plate, but it was very frustrating for me to be like, especially with COVID, all this research is coming out,
yeah.
especially if someone gets COVID and they have periodontal disease, they're 9 times more likely to die from that. Um, so I thought, if I can't change the professionals easily,
Yeah.
why not just go and give the information to patients? Because if patients then go to their provider and say, "Hey, I'm interested in this," it kind of forces the rest of the medical and dental community to get on board. So it was kind of
It's
just
true.
based off of more frustration and really just wanting to get it out there. But I agree. I think patients are really getting fed up with the way that the medical system is. There's a pill designed for everything, and then there's a pill to treat the side effects of the pill that you're taking for the original problem. And no one's getting any better, right? I mean, we're the sickest country, one of the sickest countries in the world, yet we're the richest and one of the most educated. And so something has to change because the way that we're dealing with healthcare is not effective. So hopefully this
100%.
hopefully this will help.
Yes, exactly. And I love that you have shifted gears and like, holy smokes, owning 80 practices. I would just love to hear like what is your like secret to success when it comes to, I mean, to be able to do that. There's obviously one of my favorite quotes, success leaves clues. And so I would love to
Ooh,
hear
I
like
need to write
what,
that down.
yeah, it's a good one.
Yeah.
It's so interesting when you hear about someone, you're like, interesting. Like, what was that success and what was that ability for you to do that?
A couple things. I think two things that I really credit it for is building awesome teams. So as you know, I mean, you work in this business, you cannot do everything yourself. And
Mhm.
when I first started realizing that I needed other people to help me carry the load, that was really when my career took off. So I spent
Mhm.
a ton of time, probably more time teaching, coaching, mentoring other clinicians and people in my practices and building my teams around me so that they could then go off and do what I was doing in other practices. So building
Mhm.
teams was huge. And then the other thing was just creating systems and processes, which I know you're really
Yes.
big into as well. I want to take the gray area out of everything. So in my mind, it needs to be black or white. It is or it isn't. And the less time people have to spend really thinking about something or thinking about a problem or a decision, the more time they can be helping patients and helping grow their practice.
Mhm.
So, teams and systems and processes, I would say, are the
Oh my
two
gosh.
ways that I grew.
Yes, you are speaking my language. I heard recently about one of the ways that we can like reduce stress and anxiety the fastest is by closing the loop on anything that we are still just thinking about, like anything that's in the gray area and we're confused about. It's like, how fast can you close those loops so that you can move forward? And
Yes,
sometimes, like,
yeah, go
go ahead.
ahead.
Sometimes when I'm training teams, like they kind of like push back on like systems. It's like you're stealing our autonomy, and I'm like, no, I'm giving you freedom because you don't get to think
Yes,
about this anymore. You just get to be
yes,
yourself and have fun and connect with people, and that's what you're here for, and not to think about what you need to do next. So
yes.
I love that's my language. I love it.
Oh, I have so much to say about that. So I'm learning a lot right now about decision fatigue and
Hmm.
decision debt. And so decision debt is when you have all of these decisions that you haven't decided on yet, or all these problems
Yes.
that you haven't decided on yet, and they build up, and that really wears down your prefrontal cortex. And our prefrontal cortex is how we can think and be higher level beings. And when we get fatigued or in debt from that, we start to lose our really big critical thinking skills, and then we can make decisions that actually aren't the best for the business or for ourselves. And then the other one is decision fatigue. So I think I read somewhere that you make like 30,000 decisions a day, which is insane. So as you said, if we can create systems and processes to get rid of things that should be automatic so that we can
Hmm.
use our prefrontal cortex to actually critically think about how to help patients get better,
Yes.
right? Or how to help our business grow. That's what we should be thinking about. Not all of these like mundane processes that should be automatic, which will be at some point replaced by technology. And that's the other
Hmm.
thing that I love is I spend a lot of time right now with Dental Innovation Alliance, just vetting technologies that are coming to market, because the more technology we can integrate into our practice to take away the burden of all of the little things that we don't need to spend time with, the more time we can actually spend with our patients, which I love.
1,000,000%. And I would go so far, and this is just my own theory, but I will go so far that if we could systemize and empower teams in dentistry, if like we could just like wave a magic wand, it was done, our clinicians would care more about the oral systemic link because they wouldn't be so exhausted. Like they would like
Yeah.
be able to like be freed to be like, oh my gosh, like we have to be talking about this. This has to be at the forefront of everything. And so it's interesting to think about like, what does it cost to you or to your patients and to your team if you don't have these systems in place, if you don't have these processes in place? Like the cost is huge because
Opportunity
it's
cost, right?
and just like quality and like just your ability to show up as you want to in the world because you're
Mm-hmm.
exhausted by mundane tasks or things that you have to think about that you really shouldn't as like
Yeah.
higher level CEO, operator, dentist. So
And it's hard too, especially, because I came through COVID. I was working 7 days a week. It was quite insane, and we get lost in the weeds.
yeah,
I mean, and it happens very easily. And I got lost in the weeds too. And like you said, if we don't have systems and processes or technology that allows us to like look up and look around and try and like actually pay attention to what's going on. Yeah, I mean, I got burnt out. I was one of them. That's part of the reason why I exited.
yeah,
So yeah, it's critically important for dentists to be able to integrate things like this so that they can have a great and long marathon career, right? Not
yeah,
just a sprint.
100%. What is the best advice? Actually, let me ask you this question first. What is one thing you wish every single dental professional knew?
Oh, um, That's a hard one. There's so many. I think the biggest thing that I would always say is how to be a leader. I mean, I spend more time learning about leadership and how to improve my leadership capabilities than I do actually spend on being a good dentist. I feel like, once you're a dentist, dentistry is kind of in your bones and your blood. But if
Mhm.
you are not a good leader to your team, it's your team that's taking care of your business. It's your team that's taking care of your business and ultimate or of your patients. And it's your team that's ultimately taking care of you. So if
Mhm.
you cannot lead your team, you will never get to a place of personal, financial, spiritual success because you're going to be stuck in the weeds and stressed out and overworked. So I would say I wish that dentists realize that leadership is critically important to having a healthy life, an enjoyable life, and a great practice.
I think that's so important. It's interesting. I think sometimes when we are like when we lose access to our prefrontal cortex, it trips us into our amygdala, which is like our fight
Yeah.
and flight, like our
Yes.
survival. And in that space, that survival space, like we really are just like day to day looking at the small things.
Mm-hmm.
It's so hard to put our face up and like we physically lose access to our peripheral vision.
We
It's
do.
that serious. And
Yeah.
so
We become
I
very myopic, right? It's like horse with
yeah.
blinders on.
And I think in that point, it's really hard to be a good leader. And so it's almost like you need to like pattern interrupt, like shake people out of their regular routines and then be like, okay, like let's think about what we need to do next so that you can have the life that you want. And it's really tough to get out of it, but it's possible. So
Yeah.
that's
I
what
love
people
that
need
you
to do.
brought up the amygdala. I love that we're talking about brain science here. I am
I
not
know.
that intelligent when it comes to brain science, but the circuit to the amygdala is a lot shorter than the circuit to the prefrontal cortex, right? So when emotion comes to the surface, it's because we're hardwired to go to the
Yeah.
amygdala before we actually go to our prefrontal cortex. So, anything that we can do to kind of bypass the amygdala and just keep going towards our higher thinking selves, the better we'll be.
Yes, 100%. I am like such a brain nerd. My little brother's a neuroscientist and
Oh,
we like
yeah, that's right. Yeah.
yeah, so I know a lot about this and I find it like it's highly applicable to everyday life. So
Mhm.
it's so important. What is the best advice you've ever received or given?
There's so many. One that I really like is put down the peanuts to partake in the gallery. One of
Mm,
my executive coaches used to always say that to me, and it kind of really talks about lifting your head up and looking around, right? Getting out of the weeds, because sometimes I would get so focused and so myopic on something that didn't matter, right? Like these
mhm.
tiny little details, or maybe I was having a conflict with one of my team members, and it was like an ego sticking point situation, where it's like that really doesn't matter, right? Let's focus on the bigger picture. Put down your peanuts. Start to look around. Think about what the bigger picture is and what the down the road outcome is going to be. So I have that actually written on my desk here just to remember, like, put down your peanuts.
I love that. Oh my gosh, that's so powerful. And it truly is. I think we can spend so much time, we can waste so much time, you know, not looking at the gallery and not looking at the things that are important. And kind of like one of my quotes that is very much similar to that is like, if this isn't going to be something that keeps you up at night in 5 years from now, let it go. Like, if
Yeah.
it's not important in 5 years looking back, if you're not going to remember it, like, let it go. And I
Yeah.
think we have to do that because life is, it truly is too short. And we have big missions to fulfill and people to take care of. And we can't do that if we're like stuck in things that really don't matter.
Hmm. One thing she also taught me, just to build off of what you just said, was she said, you only have so much mental capacity in a day, right? You have so much
Mhm.
time and you have so much mental capacity. So if something is occupying your thoughts and your time, just to stop and think, like, do I want to expend this on X,
Yeah,
right?
I love that.
If not, okay, let me conserve and preserve what I have so that I can go to this problem instead. So it's easier said than done, but I'm always thinking, like, I have a finite, it's like your checking account, right? You have a finite amount of resources in there. Is this something that you want to spend your money on or your
Mhm.
resources on?
And I think our cognitive bandwidth and our time is even more important than money in some
Mm-hmm.
senses because I
Totally.
think we have unlimited amounts of it and unlimited
Mm-hmm.
amounts of time and it's not true. And something in our world today where I feel like we're constantly like bombarded with distractions and more and different. It's one of our greatest challenges, I think, is like staying aligned to the vision. Um,
Oh, that
it's
resonated
tricky.
right now. Just because, as you know, I'm building this new center, and I have all of these things coming at me, which is really, and we just talked about this before recording, right? That I'm all over the place right now. And it's exciting because I'm kind of in this like phase where I'm acquiring and I'm exploring, right? All of the possibilities that are out there, but it's draining. It's taking up a lot of mental space, and it's distracting because I'm like, okay, do I want to go down the road with this saliva testing company, or do I want to put this AI technology in my practice, or do I want to use this patient monitoring system? And so just making sure that I'm staying focused on the vision is something that I'm actively working on. So that resonates right now.
It's so exciting. And congratulations again on what you're building. I think it's just brilliant. And again, like you're a maven, you're creating something that no one ever has. And so also be kind to yourself in this process of figuring it out, because if you've never built something before, nobody's ever had the blueprint, and you're literally creating the blueprint from your own alignment. It takes a lot of energy.
Oh, I'm going to record that and play that every morning when I'm like beating myself up. Remember what Allison said.
I'm going to send you, I'll send you a WhatsApp voice note after this.
Yeah, I love it. Thank you.
So tell us about your course that you have in Dentalflix, and also how somebody can learn more about what you're doing. Like, how are you, if they can connect with you? I mean, I don't want to send people to, because I know you're a busy CEO and business owner, but how can people connect with you more? I think recommending they read your book would be a great first start.
Well, actually, I mean, now is the time to connect. Because I think once the center opens next year, it's going to be like really hard to get a hold of me. So I welcome all connections right now. Like I said, I'm living in the middle. I feel like I'm laying on the ground and all the leaves are falling on me, right? That's how I envision it, which I love. It's really exciting. The book is a great place to start. So Saved by the Mouth, you can go to savedbythemouth.com or pick it up on Amazon. If you go to my website, you can actually download the first chapter for free. Read it, see if you like it. If you don't, pass on buying it. But if you do, then you can purchase from there. Another great place to find me is on Instagram. So Katie Lee DDS. Send me a message on Instagram. I'm actually pretty responsive there. So you can find me there. Or my email is katie@katieleedds.com. And then I have a couple courses on Dentalflix. I think they've been published, the Monsters in Your Mouth and the fertility one. Is that correct?
Yes, they're both on there.
So I talk about Monsters in Your Mouth is just a high level overview of oral systemic health. And so it's a really great way to get introduced to the topic. What I really like about it is I try to simplify the connection. So I believe that simplicity is the best for communication. And I'm not one to make a topic super complex so that it's unattainable for other clinicians or even patients. So it's very simple. I give really quick statistics that you can remember and rattle off to your patients. So that's a good one to start. And then the other one that I published is all about oral systemic health and the fertility connection. So right now I'm spending a ton of time doing saliva tests for patients that are trying to get pregnant. And so I talk about the oral fertility connection, how the mouth impacts fertility, both in trying to conceive, during pregnancy, and for maternal health outcomes. So check that one out also.
Oh my gosh, that's incredible. I love it. I love everything that you're doing.
Thanks.
I just want to honor you for the work that you've done in the industry, for constantly creating, iterating, and building new things to support the industry. And we love having you as a creator. So please hop into the platform, watch Katie's lectures, connect with her, follow her on Instagram. She has tons of valuable knowledge, great content on Instagram, and we appreciate having you in the Dentalflix creator community, Katie. I hope you have an amazing rest of your day. And thank you so much for all of our listeners for listening, and send this podcast to anybody who you think it could support.
Thank you so much for having me and for creating Dentalflix and letting me be a provider or a content creator for it.
Oh my gosh, it's our absolute pleasure. We'll see you on another episode of Dentalflix Uncut. Bye, everybody.
You've just unlocked valuable insights with Dentalflix Uncut, but there's more. Dentalflix is not just a podcast. It's a thriving community, a hub of knowledge, and the #1 online streaming CE platform in dentistry. With just a few clicks, you can start exploring a wealth of resources, including in-depth training on leadership, case acceptance, scheduling, hiring, weekly marketing calls, insightful gap assessments, and scorecards, all designed to help you master what you discovered today and propel you further on your path to dental excellence. Head to dentalflix.com to get started for free and embark on your journey towards mastery. Thanks for tuning in to Dentalflix Uncut. See you next time.